bit difficult, but it's also very easy bones. Okay, its name sphenoid bone, os sphenodale in Latin. It's very easy bone we will going to discuss. Okay, don't think it's so difficult. Okay, its name sphenoid bone. Okay, skull bone, sphenoid bone, os sphenodale. Okay, os sphenodale. In Latin also. Okay, it consists of 4 parts. Which parts I will going to show you where is which part is located and its name. Okay, now this is the structure of sphenoid bone. Okay, this is the located in the skull. Inside the skull is medial cranial fossa. Okay, this location, and we will going to discuss how many. I already told you we have 4 parts. 4 parts in sphenoid bone. This is this one, the upper ground. This is the lesser wing, or minor ala in Latin. Okay, this one is greater wing in Latin, major ala. Okay, next, the most important, this is the body of sphenoid bone. Body, corpus, body. Next, 4th part, outside. Remember, other 3 parts are located inside the skull. Okay, and the 4th part is pterygoid process is located in external skull. Okay, this is pterygoid process, or processus pterygoidus in Latin. Okay, this is the 4 parts which I told in sphenoid bone. Sphenoid bone we consist of 4 parts: body, corpus, body. Okay, second, lesser wing, third, greater wing, and 4th is pterygoid process, which is located in external skull. These are the 4 parts: lesser wing, greater wing, body, and pterygoid process in sphenoid bone. Yes, we discuss. Now we know which part is lesser wing, which part is greater wing, where is located body, and where is the greater wing, where is the lateral wing. Now, okay, then we are going to get each part formation. Okay, and what we have there. Now we understand where the lesser wing, where the greater wing, and where the body. First, we are going to discuss the main part like body, corpus, body, corpus. This is the corpus. This area is the corpus of the or body of the sphenoid bone. This consists of 6 surfaces. Six surfaces are fasces in Latin. Okay, which surfaces? Now the skull. If you look like this is my skull. Like this is the skull. This is the anterior view. This is the posterior view. This is superior view. This is inferior view. Okay, and we know inside the skull we have 3 cranial fossa: anterior one, middle one, and posterior one. Middle cranial fossa we have located body, and the sphenoid bone are located like that. Okay, in the skull. Now the body, we have, how we know this where the superior surface, where the inferior surface, where the lateral surface, where the anterior and posterior. For this thing, this is the body. Okay, this is the body like located like that. Now I will show. This is the this one, this surface is a superior surface. This one, the front one, this one is a interior surface. Alpha is interior. This one, here one, okay, in connection with the basilar part of the occipital bone. This is a posterior surface. Alpha is posterior. This one, this is the lateral surface. And lateral surface, we have two surfaces, both sides. Here we also have lateral surface, okay? Lateral surface. Now, this I told this is superior, and the back of superior in inside here. In the back side, there is an inferior surface. In inferior surface, you can find easily inside the nasal cavity. Inferior surface. For memorization, you like nasal cavity. Inside the nasal cavity. Okay, these are the surfaces which I told you how you will recognize this, where the surfaces of a body of sphenoid bone. This superior one, interior, front side, posterior, back side, lateral. This is a two lateral surface in pair form. Okay, these are 6 surfaces which we discuss. 1, 2, 3, 4, 5 and 6. 6 surfaces in body of sphenoid. Now each surface have formation. Each side where the connection of sphenoid bone with other bones, they have if the connection with superior, if the connection with the inferior, the connection with the anterior, posterior, where is connection, they have some formation. Now we will discuss the body, each surface formation. Okay. Now we know where is the body, which surface. Okay, where the superior, where the inferior, where the lateral, and where the okay. Now first surface, superior, we are going to discuss superior surface. Superior surface, a body, superior surface. Our first is superior surface. Superior surface formation. What formation we have here? You know, this is a fossa. Its name is hypophyseal fossa. Hypophyseal fossa. And inside the hypophyseal fossa, here we have sella thoracica. Okay. Then sella thoracica in front. Here, in front of the sella thoracica, this area in sella thoracica. Front side we have tuberculum sali, and back we have this is the back. We have dorsum sali. Okay, understand which formation we have in the in superior surface. 4 formation: dorsum sali, tuberculum sali, dorsum sali, hypophyseal fossa, and sella thoracica. This is the 4 formation of the superior surface of the body of the sphenoid bone. Okay. Now we discuss superior surface. Now the next surface we will discuss here the inferior, which I told you, inferior one, the back. Inferior surface only we have the also connection there where is the vomer bone is located. Okay, there we only one formation we have. Which formation? Sphenoidal rostrum. Sphenoid rostrum, and where the cony bone, vomer bone is connection with the vomer bone. Okay, inferior surface of the body of sphenoid bone is very easy. The only one formation in the inferior surface. Now interior surface. Interior surface, I told we are located inside the nasal cavity. In front, the interior surface you can find inside the nasal cavity. Interior surface. Interior surface or fascis interior. Okay, which formation we have first in interior surface? Three formation we have. Three formation we have in interior surface. Which one? First one is sphenoidal crest. Sphenoidal crest. Sphenoidal concha, and then here sphenoidal sinuses. Sphenoidal sinuses are aperture or apertura in Latin. Okay, there are three formations which you find in the interior surface of the body of the sphenoid bone. Okay, inside the nasal cavity they have three formation. First, sphenoidal crest, sphenoidal concha, or sphenoidal sinus or aperture. This is the three formation which you find in the interior surface of the body of sphenoid bone. Okay, now another next surface. Next surface we have posterior surface. Posterior surface we have, which I told, this is the back side, this is anterior side, we have front side, and the back side you will find where there to the if we know, we discuss in the occipital bone there is the basilar part, and this basilar part is connection with the posterior surface of the sphenoid bone. Posterior surface or fascis posterior formation only clavis, the area named where the connection with the body of sphenoid bone, and this clavis connection with the body of clavis connection with the occipital bone part. Its name is a basilar part. It means simply the basilar part of the occipital bone connection with the posterior surface of the body of sphenoid bone, or simply you can say its connection with the body of sphenoid bone. Okay, now we discuss four surfaces: superior, inferior, anterior, and posterior. But now we have the two pair surfaces are remaining. It's which one? Two lateral surface. This is two lateral surface. Okay, two lateral surfaces. Two lateral surface is remaining. Okay, which formation we have? Lateral surface formation. Two formation. Okay, two formation. One, this one, which I told, this is the also groove. This is the groove. Okay, and this groove name is this groove for carotid artery, and it means carotid groove. Carotid groove or caroticus sulcus in Latin. Okay, caroticus sulcus or carotid groove. And the second formation is a sphenoidal lingula. Or lingulae in Latin. Okay, two formation, one and two formation in the both side lateral surfaces. Okay, the lateral surface of the body of sphenoid we have two formation. This sulcus or this groove for the carotid artery or carotid sulcus. Okay, and this one is a sphenoidal lingula. Okay, now we discuss the one part of the sphenoid bone which is finished. We discuss six surfaces of the body of sphenoid bone. Okay, now we have the second. We will going to discuss the second part of the body. The second part of the os sphenodale or sphenoid bone. Okay, second part we have lesser wing or minor ala. Okay, in Latin also. Now lesser wing is a bony plate simply. Okay, bony plate. Which formation we have there? It's bony plate. Now we have optic canal or opticus canal, or optic or opticus, and this between both sides we have optic canal, and between two canals we have groove. Optic groove or opticus sulcus. Opticus sulcus. Opticus sulcus in the both between two optic canal. This is the formation in the lesser ring. Very simple. Okay, bony plate and two formation optic canal both side. Okay, and between them we have bony plate, optic canal, and between two optic canal we have optical groove. And here which I show, this is a glenite process. Glenite process. Yeah, process is glenidus. Process is glenidus. Glenite process. Which one? In front side, interior one. You also need know to remember, or else you need to remember the terminology. If you know terminology, then you will find the each parts or each body, you can find easily the surfaces or borders. Okay, this is the about the formation in the lesser ring. Okay, now with the third part of the sphenoid bone. Which third part is we have this one, greater wing. We already know, we already show in the starting of the video, we showed where is the greater wing. Greater wing or Maya ala in Latin, you can say in wing. Okay, now we'll find the formation simply. Greater wing we have four surfaces, and there we have also foramens. Okay, three foramens. This in the greater wing. Okay, first we will going to discuss the foramens, and then we will going to discuss the surfaces. For surfaces I will draw another diagram, then you will consider which surface, which side is located. Okay, and the surface is very easy. You will easily recognize by the where the surface is facing. There you know this surface is located. Okay, first we will the foramens. We have three foramen. This one, this is only you can the foramen. This is a round foramen or foramen rotundum in Latin. This foramen you can find only in inside the skull. Okay, its name first of foramen rotundum. Rotundum in Latin, and foramen round in English. Foramen round in English. Only inside. Okay, both side we have both side. Now second, this one is foramen ovale, and our foramina are Latin foramen ovale. Foramen ovale in Latin. The second one. The third one, this one is near to the sphenoidal crease. Third one is a spine foramina or foramen spinazum. Foramina spinazum in Latin. Spinazum. Okay, both sides. Yeah, spinazum. Okay, this is the three foramina which we discussed in the greater wing. They are located in the greater wing. Okay, now we will going to discuss the surfaces of the greater wing. Okay, surfaces of the greater wing. For this thing I need to draw one diagram, then you will understand. You know, we remember we have the temporal bone is located here laterally, the temporal side. Okay, this is the orbit side, this is the orbit, this is the orbit. Okay, this is the orbit. Two surface inside I will tell to you, and here is a maxillary. Okay, here is the maxilla bone. You know, this is the maxilla. This is the maxilla. This is the temporal, and this is the orbital cavity. Okay, and this one is inside the skull, cerebrum, because it's facing to the cerebrum, brain. Okay. Now first surface facing temporal surface, because here is the where the you can also see from here, if we know, we discuss already in the parietal bone we have sphenoidal angle, and this sphenoidal, why this called sphenoidal angle, because the temporal surface of the sphenoid bone, or the greater part of the sphenoid bone, is located here. Okay, that's why we call this is a sphenoidal angle in parietal bone. But here is a which why is called temporal surface, because it's near to the temporal, that's why it's called temporal surface of the greater wing. Okay, this is temporal surface, and why in the orbit, this area we discussed in the frontal bone, and this area is for sphenoid bone. Okay, greater wing, and this is the orbital surface, and here this area is located in the near to the angle. This is a maxillary surface, because this is facing the maxilla. 4 surfaces we have in the greater wing. First one which we discuss is cerebral surface, facing the cerebral surface. First one is cerebral surface. Second one is a temporal surface, which facing the temporal bone, temporal surface. Third one is we have in the orbital surface, this one, orbital surface, which facing the orbit inside the, and fourth surface is a maxillary surface, which facing the maxilla bone. Okay, these are the 4 surfaces of the greater wing. Cerebral inside, others one is temporal side, temporal surface in the temporal, and orbital surface inside the orbit. Okay, and the fourth one is maxillary surface, which is facing from the angular here in the maxilla bone. Okay, these are the 4 surfaces of the greater wing, which I put 4 surfaces and 3 foramina in the greater wing. This is the third part which we discuss in the sphenoid bone. Now we have the fourth part of this one, this part, which I told you is located outside the skull. Okay, outside the skull they are located. It's mean pterygoid process, and processus pterygoidus, processus pterygoidus, okay, or pterygoid process, the 4th part of the body of sphenoid bone. Part of the sphenoid bone, or sphenodale. Formation, which formation we have? Now, this is laterally located, lateral side, this is a medially, and this is between them we have fossa type area. Okay, now formation, first we have lateral plate, next one we have middle plate, third one we have pterygoid fossa, because the area is name is pterygoid fossa, and at the base of pterygoids here in outside you will can see in outside. Okay, in the base of pterygoid process you can see canal, is name pterygoid canal. Remember 4 formation, 1, 2, 3 and 4 is the 4 formation in a pterygoid process. In Latin, lamina, plate means is lamina, okay, lamina lateralis, lamina medialis, fossa pterygoidus, and canal pterygoidus. This is the 4 formation which you find in pterygoid process. This is the sphenoid bone, which I told is very easy. Is very easy for understanding. You will your concept will clear very easily. Okay, 4 parts we discuss. Then body we have 6 surfaces: superior one, inferior one, anterior one, and posterior one, and 2 lateral surfaces. Then in the lesser wing we have optic canal and optic sulcus. Greater wing we have 4 surfaces and 3 foramina. 4 surface: cerebral surface, temporal surface, orbital surface. Is also clear from the name. Orbital surface, temporal surface, cerebral surface is very easy, don't confuse, and maxillary surface. And in pterygoid process, lateral plate laterally located outside means, and middle plate means mid side, and between them we have fossa, and at the base of the fossa we have pterygoid canal. This is very easily which we discuss.